6 months ago, we hadn't heard of COVID-19. But where are we now? Johns Hopkins University have been live tracking the data and updating this map for us. And we see a very grim milestone reached. The total number of deaths now exceeds 500,000 people who've died with the infection. Not only that, if we look at the global outbreak, we've had over 10 million confirmed cases. And we do know that that number is likely to be an underestimation of the scale of the outbreak across the globe. So where is the virus still rapidly accelerating? Well, particularly in the Americas, across the United States, but Brazil and Mexico are seeing sharp rises in the daily number of new infections. That's a similar picture in Asia, in India, in Pakistan. But surprisingly, the death toll has not been as high in those countries. Well, in a couple of minutes, we'll be hearing from the World Health Organization, speaking to them to ask them about the figures. But let's take a look at Europe, particularly Italy, one of the world's worst hit countries by the infection. Well, this weekend, the country marked the fact that 35,000 people died with the infection. Evelyn Laverick tells us more.
President Sergio Mattarella pays a visit to Bergamo, the one-time epicenter of Europe's coronavirus outbreak and one of Italy's hardest-hit provinces. He was there to honour those who had died with a requiem concert, but first he warned his fellow countrymen and women that lessons must be learnt.
Remembering means seriously and with rigorous precision, thinking about everything that didn't work, about the systematic deficiencies, and about the mistakes to not repeat.
Since the beginning of the COVID-19 outbreak, Bergamo has reported over 13,000 coronavirus cases with more than 3,000 deaths. Since the virus first emerged in China last year, infections across the globe have reached the 10 million mark, half of them in the US and Europe. In the UK, the government is considering imposing a local lockdown on the city of Leicester in the East Midlands. A surge of cases there prompted the Home Secretary to warn against being reckless as restrictions are eased.
I cannot think of anything worse than us having another wave of this awful disease. That would then result in more lockdowns, local lockdowns, and of course that means we'll be retreating back after the big gains that we have made across the country.
Beyond Europe, COVID-19 is rapidly growing in the Americas. In Brazil, over 53,000 people have died. President Bolsonaro, who has called the virus little flu, did recently pay tribute to victims, but has once again been seen without a mask in public, despite being ordered to cover up by a judge. Evelyn Laverick, Euronews.
Well, global health expert Dr. David Nabarro is the World Health Organization's special envoy for COVID-19, and he joins us now from Geneva. Good morning to you.
Good morning.
But we've just heard some pretty grim figures in terms of the global death toll, the number of confirmed infections. But for you, how useful are these sort of global tallies, and what are the areas that you're particularly concerned about?
Thanks very much. When you did the report just now, I heard you make the point that the figures for numbers of cases are bound to be an underestimate because, particularly with the virus moving into poorer countries, there will not be testing facilities available for everybody who needs them. So what these numbers do is they give us a rough idea of what's happening. Here it is in summary. The level of virus is increasing rapidly all over the world. There is a particular concern about what's happening in Latin America, South Asia, and parts of Africa. It's really important that everybody everywhere take it seriously. It doesn't seem to be sparing any country or region. And we are going to get new resurgences in Western Europe, even though numbers have come down. It's inevitable because the virus is still very much with us. And what we have to do, everyone, everywhere, is to be able to defend ourselves against it with the strong support of government health services and indeed of everybody else in society.
So are there some countries that you think aren't taking this seriously enough?
I'm really careful about critiquing individual nations. It doesn't usually win us friends in the World Health Organization. But what I'd like to say is that the countries that are doing best are the ones that have put a lot of effort into working out where the virus is and have also got well-developed plans for what has to be done when an outbreak does build up. We've seen that in Germany, for example. There are outbreaks linked in one case to what's happening in a food processing factory. And that's led to a movement restriction in one area and an urgent effort to actually suppress the outbreak quickly. That's going to be the pattern of the future. We will have this virus continuing to come back. We will need to be able to suppress it fast. And we'll all need to know what we must do to stop infection from spreading. And that's why face protection, plus, of course, physical distancing, will remain absolutely essential. And we've got to look out for people who are poor, because quite often they don't have the flexibility to actually adjust the way in which they live and work so that they can reduce their risk. And that's an important reality of dealing with the outbreaks now, is focusing on those who are less easily able to make the decisions for themselves.
How much has actually changed since the outbreak was first originated that now makes it safe for people to be going outside, for restrictions to be eased? Because it seems as though we may just be in this revolving period of going into lockdown, lifting lockdown, until there is a significant change in how we're fighting and dealing with the infection.
I think you're so right. It's all up to us. If we're prepared to take it seriously and to see it as our responsibility, not only to look after our own health, but also to keep other people healthy, then we'll be able to deal with it. But if for any reason either individuals or groups of people say, oh, I can't be bothered, I'm just going to go on just behaving exactly as I want, then we have a problem on our hands. I think it'll take a bit of time, though, for people to make sense of this. You know, it's such an amazing new thing to discover in life. You said we've only known about this virus for 6 months. So what I'm encouraging everyone everywhere to do is to spend a bit of time making sense of what this virus means for their lives, for their workplaces, for their families, for how they socialise. Because over time, that's what's going to reduce the threats that we all face. I hope that everybody who's watching this will actually start saying to themselves, I've got a role to play on this.
Thank you very much. Global health expert Dr. David Nabarro, the World Health Organization's Special Envoy for COVID-19. Really appreciate your time.